14th, 2025. Well, I'm going to have to concede that I guess I had overestimated the degree to which China would be a confrontationalist in this whole trade war, at least up front. I fully expected this thing to be a lot more protracted than what occurred over last weekend. The it looks like that Trump has really pulled one out pretty well here, and so as I said, you don't underestimate the guy. He you can think he's going off the rails, but he usually pulls it out and comes out looking pretty good. So we'll have to see how this one goes. But what I found interesting about the outcome is it started off with we putting a 34% tariff on Chinese goods, right? And then I think there was some other things being floated around there. And anyhow, they then the Chinese retaliated, and we retaliated, and the thing got to some ludicrous levels of 145% and 125% the other way, and all that. But the deal they came up with, well, there's a 20% delta in the final outcome, and so they basically just reduced it down to 30%, which is just not that much different than his original tariff, if you will. And I guess we're still working on some of the other side issues, which are pretty important, like the intellectual properties and other barriers to trade, the fentanyl, and things of that sort. But at any rate, it looks like we've got a 90-day reprieve here, and so it looks like his poll numbers are starting to go back up, and so it's working out pretty good. And uh, so we'll have to, keep on this thing. It is kind of interesting though that his negotiating strategy was such that it went to a ludicrous level, and then they got at a meeting, and then they calmed down and come back to pretty much what he was shooting for anyhow, or within a few percent of it. Now I don't know if that's going to be permanent. He's talking like he only wants a higher number, but I can't imagine a permanent number much above 30%. I mean that's a pretty high tariff, really. I'm not even sure that will hold for the long term, but we'll see. Um, but uh, but at any rate, I think that probably you had significant layoffs in China and the manufacturing industry. Ships were backed up full of goods with nowhere to go on their side, and on our side, we had the prospect that come summer we're going to see a lot of empty shelves in Walmart, etc. So I think this led to people cooler heads prevailing and coming to a reasonable a deal. So I think score one for Trump on this one, and it'll be interesting to see how it only plays out. We're keep an eye on this one. Uh, if you like these videos, please give me a like, subscribe, and click the bell for notifications. You also can follow me on Rumble at the address in the description below. So this is just one aspect of what's going on. Now, the next thing, of course, was his venture into the pharmaceutical pricing, which I can say that all the people interested in the UAP issue are really disappointed because they were expecting it was going to be the release of the UAP secret, right? And instead, it turned out the thing that was waiting for decades that everybody was going to see was obviously the drug announcement, the executive order. And of course, I'm still not sure exactly what the legal authority is. When they talk about most favored nation status, I'm beginning to think what he's talking about is that it is the idea that they could import the drugs back from the foreign countries that were selling them at prices lower than what the American market is. If that's what he means, well, I'm not sure. I'm not sure they would want them to be sold back actually in any quantity when they saw that happening if they have this great deal. But at any rate, obviously, talking cuts of up to 80% in the prices is not really viable for the drug companies because it misunderstands the situation we're in and why we're in it. The We have to understand that the American pharmaceutical companies first have to develop their product for the U.S. market and go through FDA approval, the so-called phase one, phase two, and phase three approval. It involves a lot of tests and all the things you got to go through for safety and effectiveness and so forth. in order to get that in there. In addition, of course, there's a lot of legal issues involved, and of course, if a side effect happens to affect somebody, they have to be prepared for legal damages. So there's a lot of money involved in this process. And so naturally, and remember that their ability to exclusively sell this product is only going to last as long as the patent holds. And they usually are under patent while they're in evaluation so somebody else don't steal it. So the result is they only get a few years of use of this thing at full price before it goes generic. All right, so that's the lay of the land. And of course, what's and of course these prices are way above the actual manufacturing cost for the particular drug, pill, or whatever it is, whatever form it's in. That's generally very small compared to the actual price at what's under patent because of these other costs that are thrown into the mix. Okay, so um, what happens is then when they go to foreign countries which have socialized systems and price controls, your Canada, Britain, Europe, and so forth, and as well as smaller countries like, I mean, I should not say smaller, but poorer countries, let's say the third world type countries. They're but in the socialized countries, what happens is they want to go get approval to sell it there, and they get that, and these people say, well, we've got these price controls, and although you may be selling it for $5 a pill in the United States, here we're only going to let you sell it for $1 a pill or whatever, maybe two, whatever it is. And so, from their point of view, they could make a profit just selling it to the United States exclusively. So, but if you can make more profit by selling it to these foreign countries, they go ahead and accept whatever the terms they have are, more or less. Negotiate a deal, and they get those deals. Then you get into the third world countries, and they don't have near as much money. Their people can't afford to pay those prices. So they say, well, it's only cost me 10 cents a pill to really make it, so I'll sell it there for 50 cents or 90 cents or something like that. Whatever, really low price. Because again, they're making extra money, and why not? Well, then all of a sudden comes around like President Trump and says, well, this just isn't fair to the American people. So if you force them to come down in price that far, I suspect they would probably be willing to forego those foreign markets before they would actually cut the prices. So I don't know. This could be interesting. I mean, obviously, if it was just forced on, they'd go bust. I mean, they wouldn't. They would. I mean, they wouldn't be able to have any money to really function probably and develop new drugs. I mean, I don't think if you look at the stocks and all, they're profitable companies, yes, but they're not ludicrously profitable. They're not always, only if they have some, new thing that's really beating the market or something like, say, something like Moderna during the COVID thing or something like that. But that's a special case. The usual main pharmaceuticals during most of the year, they're a solid, they're a good bet, but they're not it's not like it's highway robbery, really. It really isn't. And so I think that something's going to have to be worked out on it. And they said there are going to be some negotiations, or there may be a bunch of lawsuits. Because the authority to do this, I don't know. I mean, ultimately, the ultimate reaction, if we're talking about just bringing drugs back in from foreign countries, then just don't sell to them. That'll dry that up real quick, or limit the amount of sales you make to the foreign country to a level that basically they wouldn't be willing to let them go back. And I think they would be the ones that stop it because they want their good deal. So I think this is going to get worked out, and I suspect, just as always, Trump will somehow end up the winner here, and probably we'll end up paying less for the drugs than we're paying now. And remember, the big thing is who buys the most drugs, really? Well, really, it's the Medicare and Medicaid programs funded by your government, right? And so if you can get the cost down, that means the cost of these programs can be cut as part of the effort to bring the budget under control, and at the same time doing it without reducing the quality of services to the public. Kind of a win-win. So that's what I think he's shooting for, and we'll see how that plays out. I mean, it's a bold move, but very interesting. And of course, now we've seen Trump in Saudi Arabia making big business deals with various Arab countries and bringing more and more investment back in the United States. So That's definitely what you have with a businessman president. So I guess I'm a bit more upbeat on it. Although on the inflation, yes, the numbers were very low, 0.2%. You know, the latest inflation report. However, I think it's going to be that's because the impact of these tariffs haven't hit yet because these companies, in anticipation of tariffs, were importing a lot of extra goods before they took effect. And so, for the moment, things are doing pretty good. Plus, it was also expected, I think, that the inflation would come down during this time period that we're in right now, and maybe the next month as well, or so. But I think what you're going to start seeing an increase in prices still because, even 30% tariff is not something that's not going to increase the price of those goods, and that will be in place, I guess, for 90 days. So, and then we'll see what comes next. And even at 10%, things are going to go up. So, but at any rate, that we'll cross that bridge when it comes to us there. And and finally, I guess the discussion about we'll see what happens with the idea of Zelensky and Putin meeting in Turkey. My prediction is it won't happen. Uh, I think it's possible that Russia will send a delegation to negotiate, but we're talking about the foreign minister level type people, not the presidential level people. And of course, if that happens, I suppose that Zelensky, if he goes, won't be willing to talk to them, and the Russians won't be willing to talk to him because they're going to say, well, he's not a legitimate president because he's overstayed his term. And I think we've heard that story before. So I think this is a lot of positioning and propaganda positioning, and we'll see what then comes next. So I'll be wrapping this up for now. I'll be post this on YouTube and Rumble, and of course the addresses of my social media accounts are in the description below. Look for me to post the most on X between videos. All for now.